All right, so today we're diving into a medical condition that kicks off with something you've probably had 100 times. But as we're about to see, underneath that common symptom, there's a serious emergency playing out in silence. I mean, that's a pretty startling thought, right? We all get sore throats, we all get fevers. But what if those super familiar signs were just a mask for something way more critical going on inside your body? Let's start by looking at those first, really misleading clues. So it all begins with a feeling we know all too well. You just feel off. That general sense of being unwell that's so easy to just brush aside. You figure, hey, it's probably just a cold. Maybe the flu's coming on. Nothing a little rest can't fix. And these symptoms, they're the perfect disguise. In the medical world, they call these prodromal symptoms. These early, kind of vague signals like general malaise, a sore throat, fever, some chills. For most of us, we just grab some tea and not think twice, totally unaware of the real problem brewing inside. Okay, so while your body is sending out these very common distress calls, something incredibly dramatic and dangerous is unfolding on the inside. The defenders of your immune system, they're literally vanishing. And this culprit, it has a name: agranulocytosis. I know, it's a mouthful, but the definition gets right to the heart of it. Severe neutrophil depletion. We're not talking about a small dip here. This is a catastrophic loss of a very specific, very important type of white blood cell. So, what exactly is a neutrophil? Well, this is just the perfect way to think about them. Neutrophils are your immune system's first responders. They are the frontline soldiers that rush to the scene of an infection to fight off bacteria and other invaders. So agranulocytosis means your army's entire front line has just disappeared, leaving you completely vulnerable. And seeing it side by side like this makes the danger so incredibly clear. On one side, you've got a healthy system totally staffed, ready for battle. And on the other, you have the reality of agranulocytosis. It's an undefended fortress. Any tiny infection that your body would normally crush in an instant can now become a life-threatening event. So what causes this sudden desertion? What makes these troops just disappear? Well, in most cases, the culprits are actually external, specifically certain medications. Things like chemotherapy drugs and anti-thyroid agents are pretty common offenders. But in rare cases, it can be something someone is born with, a congenital syndrome like Kosman syndrome. So as the body's defenses stay offline, those initial vague symptoms start to morph into much clearer, much more alarming evidence that something is seriously wrong. Without those neutrophil soldiers to fight back, infections just take hold and run wild. This can lead to things like swelling, a deep pain in your bones, and even serious conditions like pneumonia. Your mouth is often one of the first places you'll see really clear signs, with severe, painful gum infections that can cause the tissue to literally decay. And check out this clinical description. It is chillingly precise. Punched out ulcerations. We're not talking about a simple canker sore here. This is a very specific, very dramatic sign that the immune system is completely failing. It's a key piece of evidence in solving this whole medical mystery. And here it is. This is the final clue you'd find under a microscope. When doctors examine these ulcers, they see something bizarre: a lack of host inflammatory response. See, inflammation is the sign of a battle. It means your body is fighting back. But here, the battlefield is just quiet. And why? Because the soldiers, the neutrophils, never even showed up to the fight. So the mystery is solved. We know what's happening. How do we close the case and get things back to normal? Well, thankfully, once agranulocytosis is diagnosed, the path to recovery is surprisingly clear. The treatment is basically a clear 3-step plan. First, and this is the most critical part, stop the cause. If a drug is the problem, you stop it immediately. Second, you manage the damage that's been done, using things like antiseptic rinses for those oral ulcers. And third, you bring in reinforcements. Since the body can't fight for itself, antibiotics are crucial to take down any active infections. And for some specific cases, like those linked to cancer treatments, there's an even more advanced tool. It's a therapy that uses something called a colony-stimulating factor to basically tell the body, hey, start making new neutrophils again. It actively helps to rebuild its own army from the ground up. And all of this brings us to one final big thought. Agranulocytosis really shows us how something as seemingly harmless as a sore throat can actually be the tip of the iceberg for a critical internal collapse. And it leaves you with this question, doesn't it? How many other silent emergencies might be hiding out there, in plain sight, just waiting for us to look a little closer?